This World Cancer Day, take action. Pledge to advocate. Your donations to national cancer causes fuels research, supports care, and creates a brighter future for those affected. Pledge to get your annual screenings. Early detection saves lives, giving you the power to act before it's too late. Pledge to adopt healthy habits. Stay active, eat nutritious meals, and prioritize your well-being. Healthy lifestyles can reduce your risk of cancer and pave the way for a healthier future. Make your pledge and act against cancer with lifestyle, screenings, and advocacy. Together, we can make a difference. This message is brought to you by the Ministry of Health, Wellness, and Elderly Affairs.
Good afternoon, everyone. My name is Naomi Grandison, and I am honored to welcome each and every one of you here today for the first ever Cancer Talks panel discussion at Sir Arthur Lewis Community College. Cancer Talks, the brainchild of oncologist Dr. Owen Gabriel, aims to be a catalyst for change and progress in the prevention, diagnosis, and treatment and overall care of all cancers. In St. Lucia, prostate, breast, cervical, ovarian cancers, colorectal, and even skin cancers are among the most prevalent types. This year, as we unite under the global theme, United by Unique, we recognize that every cancer journey is different, yet together we can make a difference. With our national theme, Act Against Cancer, we are reminded that awareness must be met with action through education, early detection, treatment, and support for those affected. The Ministry of Health, Wellness, and Elderly Affairs is grateful for the collaboration with Sir Arthur Lewis Community College, along with our esteemed panelists, as we engage in this vital discussion. We now invite you to eavesdrop on cancer as it shares its stories and insights through the voices of real people impacted by this disease. It is my pleasure to hand you over to Dr. Owen Gabriel, oncologist and moderator for this afternoon's proceedings.
Thank you so very much, Nurse Grandison. Although she's not seated here at the table, she is the true driving force behind this entire event. Without her input, we would not be here today. And hopefully, from the first occurrence of this event, we are sure that she will take it to the highest levels and bring the issue of cancer to the fore of St. Lucia, to the region and beyond. So thank you this afternoon, audience present here and those online. We are happy to be at Sir Arthur Lewis Community College and in collaboration with the Ministry of Health and our partners. We hope that this afternoon's encounter will enlighten you on the issues we confront with cancer in St. Lucia. As you all know, yesterday, February the 4th, was celebrated as World Cancer Day 2025. And if you would allow me, I'd like to read out the official statement from the Union International for Cancer Control, as is distributed to our affiliates. And I'm sure it will enlighten you as to why we celebrate World Cancer Day. World Cancer Day is an initiative of the Union for International Cancer Control. It is the largest and oldest international cancer organization dedicated to taking action on cancer. The UICC unites and supports the cancer community in its efforts to reduce the global cancer burden, promote greater equity, and ensure that cancer control remains a priority on the global health and development agenda. It was founded in 1933 and based in Geneva, Switzerland. UICC has more than 1,120 members from over 172 countries and territories. In fact, St. Lucia, luckily, is honored to be part of the UICC. The base includes the world's major cancer leagues and societies, research institutes, treatment centers, hospitals, ministries, of health, public health agencies, and patient support groups, some of which are represented here today. So what is World Cancer Day? World Cancer Day is an international day born on February 4th of the year 2000 at the World Summit Against Cancer for the New Millennium in Paris, France. It was birthed to raise awareness about cancer, encourage its prevention, and mobilize action to address the global cancer epidemic. It aims to support the goals of the World Cancer Declaration. So, yesterday, on February 4th, World Cancer Day 2025, we stood together in hope, strength, and resilience. Yesterday, we honored the millions of lives touched by cancer. Those who are fighting, those who have fought, those we have lost. It's a day to reflect on the progress made in research, treatment, and cancer care, but also to acknowledge the ongoing journey towards a world where cancer no longer has the power to take away what we hold dear. If I may have the next slide. The theme for World Cancer Day 2025 is United by Unique. This theme highlights the importance of personalized care and treatments to cater to each individual's unique needs. Cancer prevention, according to the WHO, suggests that between 30 and 50% of cancers can currently be prevented by avoiding risk factors and by implementing existing evidence-based prevention strategies. And I'd like to share 5 of those key ones with you. Number 1, quit tobacco use, as it is one of the leading causes of cancer. If you smoke, seek help to quit and avoid exposure to secondhand smoke. Currently in St. Lucia, through the Ministry of Health, there are a number of avenues to seek support in quitting smoking. Secondly, eat right. Focus on consuming a diet rich in fruits, vegetables, whole grains, lean proteins. Make a conscious effort to minimize the use of processed foods, red meats, and sugary beverages. A healthy, well-balanced diet will help you maintain a healthy weight and control other risk factors. Number 3, get regular checkups. Early detection is key to effectively combating cancer. Regular screenings and checkups can help detect and treat cancer early. Number 4, get vaccinated. A controversial topic, but vaccines can help prevent certain types of cancer, such as the HPV vaccines, which can help reduce the risk of cervical cancer and other cancers. The hepatitis B vaccine, which can protect against liver cancers. And finally, number 5, maintain a healthy BMI, body mass index, and stay physically active. Exercise. Obesity is linked to various types of cancers. Aim for a balanced diet and regular physical activity to maintain a healthy weight. Every step forward, every breakthrough, every person who continues to fight brings us closer to a future where cancer is no longer a threat. Let us unite in support of those facing this challenge and commit to creating a world whose hope and where hope is stronger than fear and where no one faces cancer alone. Together, we can make a difference. Together and every day, we can continue to spread awareness, support research, and lift each other up. The fight against cancer is not one we can face alone. Together, we are stronger. Thank you. So with this introduction, I'd like to invite you to converse with our panelists here today. I have been charged with the responsibility of allowing each person here and those online to have a voice in today's discussion. This is called Cancer Talks, and it's a play on words, not just to say that the cancer will speak to us in terms of the information that we get about cancers, but that persons who have experienced cancer, whether as patients themselves or families, support persons, relatives, friends, also speak on their journeys through cancer. We also have organizations, government organizations, NGOs present here. We want to have the voices heard of each and every one of you today. So this is interactive. We don't want it to be something where it's very formal. We want you to intervene because what we want to have are discussions about cancer. So I am pleased and very honored to introduce you to our panelists here today. I'd like to start at the very end of our table. Ms. Gifter Jonge is a field officer at the Central Statistics Unit, and she has agreed to come here today because she currently supports a person with cancer, a relative with cancer. That's right. And she would like to share her journey with us today. And I chose to introduce her first because we sometimes do not see the persons who are in the backgrounds of those persons fighting this terrible disease. So we are happy to have her today, and I'd like you to give her a round of applause for her bravery. I am absolutely honored to introduce someone whom I've known for quite a while now, who has never refused to collaborate with us, whether it is being hands-on in providing patients through the soup kitchen, serving patients in our clinics, going on our health fairs, talking to persons who need some counseling, advising persons. I'd like to introduce you to Ms. Dawn Flosack, who, it may not seem to be the case, is actually a cancer survivor. And I think she deserves a round of applause. Not all cancer survivors are brave enough to present themselves to the public. And I think she's opening doors and breaking barriers by speaking with us today. Thank you, Ms. Flosack, for coming. Next to Ms. Flosack, to her right, our esteemed colleague who has been a champion for cancer control in St. Lucia in terms of surgical interventions. Dr. Kabi Dawit Daniel is a general surgeon specialized in endoscopic surgery, laparoscopic surgery, who has been with initially with the Ministry of Health through the Victoria Hospital since 2003 or 2004? 2003 yeah. At Victoria Hospital. Dr. Kabi has performed surgeries which have never been done in St. Lucia prior to his arrival. And he has been a champion in the cause of cancer control and prevention. And I'm sure you will all be shocked by his efforts and his contributions and what he will share with us today. Next to me is Monsieur Josue Prevelos. I hope I did that well. Mr. Prevelos is a project officer at Universal Health Coverage Unit in the Ministry of Health, who has been with us since 2023 and has been very active, very busy, I might add, in all kinds of projects concerning non-communicable diseases, palliative care, courses that we have done together, training courses for caregivers and for health professionals. Mr. Prevelos has a lot to say about what UHC has to offer for those of us who take care of patients with cancer and other non-communicable diseases, and the resources available, the financing and other avenues available for patients who suffer from this disease. So thank you all for coming today, and I hope we have a healthy discussion. So our next slide should say, I would like to start off with this slide. I'm sure you here, our live audience, will not see those slides, but our audience online are certainly seeing the slides that we have presented. I'd like to have our panel discuss, and the audience as well, what exactly is the cancer problem? What is it, why is it that we sit here today? Why is it that we talk about cancer? Why is it that so many people are concerned about cancer and whether people can survive cancer in St. Lucia? So I don't know whether any of our panelists will want to volunteer to answer that question. What problems do we confront when we talk about cancer?
I'll start.
Okay, Ms. Rosak.
I would say, for me, what is cancer? For me, for the wider population, is fear of the unknown. And you get this diagnosis and immediately there is fear. But while there is fear, there is hope. And Dr. Gabriel said something a while ago that you wouldn't believe it, but I am a cancer survivor. And I'm a survivor in part because I never hesitated. I left Dr. Cabier's office after getting the news, and my next stop was Dr. Gabriel's office. I never hesitated. My grandmother and my father and my grandaunt all died from cancer. So, although I was young, I knew that time was of the essence, and I immediately did what I had to do. So in part, it was taking the initiative, although the fear was there, that I had to play my part in getting better. I trusted the professionals because I couldn't heal myself. I had to put my trust in them, not in friends, not in people telling me all what I could do or should have done or will do to get me well. And I'd like to say that we have to overcome the fear and the stigma of cancer. We didn't ask for it. We were chosen for some reason. So, in my mind, we have to do everything possible that we can to overcome this. So, as a survivor, I feel if I can help someone, if I can advise someone, I need to do that. That's the only way we can reach everyone. I'm sure everyone in this room has someone they know, a relative, a friend that has gone through this or is going through this. And we can't keep it to ourselves. We can't hide it. We have to bring it out and let people know that you can survive, but you have to play your part. You have to, it has to be early. You have to take the advice that is given to you by the professionals so that you have a good outcome. That's my contribution.
Thank you. Thank you. I'm just so happy that we have this open heart discussion this afternoon, because I'm sure Ms. Jonge, do you have anything to add in respect to what is it that we think of? What happens to us when we confront the problem of cancer?
As a caregiver of cancer, of cancer patients currently, and a sister of mine who was recently deceased with cancer, I too, it instills fear in me also. Probably because of the experience of the deceased sister and my current situation. But when I think of cancer, or when I look at cancer generally and the persons that I tend to, that are immediate family, I just tell myself, you have to be there. All what they need is our support. And our support comes in all forms, not just financially, emotionally, socially. It's like we are all they have after that diagnosis of cancer. So to me, cancer to me, in my current stage, is being there and to offer support to the cancer patients.
Thank you, thank you. And these are some of the experiences that I hear all the time. Mostly I hear people coming and say that sometimes there are 1,000 problems on your mind, whether it's your car, your job, your relationship, your finances. All of these problems may hover over you. But the minute that that diagnosis is given to you, everything else pales. Sometimes they cease to exist for you because you are focused on that one problem that is so overwhelming. And it's life-threatening. In fact, I mean, there's a whole specialization of what is called palliative care that seeks to reduce pain and suffering for persons diagnosed with a life-threatening illness. Just early on, Mr. Prevost asked me before we started that he found it unusual that people live well, sometimes having the illness, but unknown to them. As soon as it is told to them, as soon as the diagnosis is delivered, you see an immediate decline in not only their spiritual, psychological, emotional, but their physical well-being. And this is a phenomenon that we know exists and is very real. Would you like to expand on the thoughts that you had concerning this?
Of course, and I am happy that I allowed the ladies to open the floor. That's why I was being quiet, to give the ladies priority. Again, the problem of cancer, I think we live in a society where we are more reactive. Reactive in a sense that we wait until things happen and then to look for solutions rather than prevention. First of all, I would like to apologize for our director, who is Dr. Alicia Ford, the director of UHC, University of Coverage at Ministry of Health. Due to prior engagement, she couldn't make it, so I will be speaking on her behalf. Yes, to continue, the government of St. Lucia has given the go-ahead with to the Ministry of Health to implement UHC, which is a universal health coverage. In that aspect, as everybody will know, that universal health coverage is offering a full range of services to the life course of the individual. It includes health promotion, which is the nurses doing in the department, which is part of this what we're doing now. And we have rehabilitation. We look at rehabilitation. We look at treatment. We look at the palliative care, the training, all the training we have been doing under Ministry of Coverage to help those who are caring for cancer patients and give them more hope. In that sense, when I asked Dr. Owen Gabriel that question, why I've observed lately over the years, people who are reaching stage 3 cancer, they were living fine prior to that day they get the news. But they were still at age 3. But by the time they get that news, everything finished, everything done, everything's over, and physically, mentally, emotionally, financially, everything is going down the drain. So how can we help with that? I really appreciate that discussion, that forum discussion with Nick people and our dear panelists as well, who open up herself as a cancer patient, which means that it is not something you should hide or be afraid or fearful of. So if you have it, if you have it, then you know, seek for the proper care, proper attention, and guidance, and to know where you might be needing help, and the doctors around here, they will give the guidance necessary. In terms of prevention, if you get to go through a screening, I don't want to go ahead of what we offer in the UC. I know those questions will be coming up to Gabriel. If you go through prevention, it will allow you to know at what stage you are. If you're 0, if you're 1, what is it? And what are the major precautions you can take to avoid climbing up the ladder and getting worse. So, to allow Dr. Gabriel and Kabi to jump on board as well, I will keep on what I have to say right now and to, yes.
Thank you, Mr.
Yes.
Privileges.
Yeah.
Dr. Kabi, do you have anything to contribute to this part of the discussion?
Well, I think all panelists have said the most relevant aspect of cancer. For me, cancer is life-altering disease where usually the patient and relatives and the workplace and the community at large society gets involved or affected by it. In a way, it's a catastrophic illness. It just your economy will be affected, your emotions, literally all your life goes, just lights goes off. Unfortunately, we tend to diagnose it first and then give the bad news to the patients as a surgeon. Usually we are the first line in terms of doing the biopsy, getting the diagnosis, and giving that news. After probably, I would say, 30 years now in practice, it takes toll on you sometimes, but you know how to, break the news. Sometimes you have to get the relatives with the patient to break the news because the patient just black out. They do not have idea what you said. You just black out or they freeze and they are emotionally, basically altered. Is a bad news in a short period of time. So overall, I think it comes down to the major issue. I just mentioned everybody getting involved. That team, or even the African proverb saying, if you want to go fast, you go alone. If you want to go, far, you go together. And that comes down to this. And if we are able to achieve, then I could mention, for example, Michael Jordan in one of the games. He could not have won his second or third bit of the game unless he went and looked for a roadman from Las Vegas hotel and so forth. He just disappeared because he said he couldn't handle it. So he understood he was part of that, the cog and the wheel of the team to take them to the win. If we achieve or if we approach the cancer condition, as everybody's, society at large, then probably we'll go somewhere and we'll probably, take it a notch. In terms of from where cancer used to be to cancer now, there are lots of changes, there are a lot of understanding, there are lots of new technologies and better survival rates. But now emulating that from first world countries to St. Lucia, it requires, government, society at large, everybody involved and being able to work as a team. Comes down to the same thing, as a team. The leader recognizing the equality of all the team members and usually the leader should be the patient and probably the oncologist, but recognizing that and being able to push the need of the patient, tailored to uniqueness of each patient. That's my contribution.
Thank you, thank you. Thank you, Dr. Kabiye. I've interpreted from what has been expressed so far that it's the question of fear is very primal to the question of the cancer diagnosis. The question of stigma. Again, we know in St. Lucia that a lot of times people who become ill sometimes attribute it to some sort of superstitious intervention, a curse. In our local parlance, it's a cobia or voodoo. So these things predominate in our society and sometimes are obstacles to seeking care in the right circumstances. So Dr. Kabiye alluded to the question of the team. A lot of times, and I say this because Ms. Frosak said that she had some family members who had been diagnosed with cancer. I'm sure, did you say some of them died of cancer?
Yeah.
So sometimes, a lot of us don't even know what our risks are, health risks. So when you do medicine, they teach us about personal risks. That has to do with the lifestyle issues that I mentioned earlier. Are you smoking? Are you consuming foods that are unhealthy, not exercising? But also family risks are crucial. And a lot of us ignore the family risks. Although some cancers, you know, are hereditary, but we must be cognizant that if we know that close relatives had cancers and died of cancers, we must start maybe our screening earlier than usual. And that is important for breast cancer, for instance. Although, you know, they say maybe 5% of breast cancers are hereditary, maybe up to 11% sometimes. The majority are sporadic. But we still know that if a mother or first-degree relative has had breast cancer, then it is imperative to have that daughter start her screening mammograms at an earlier age. Currently in St. Lucia, we start doing mammograms, I think, at age 40. In the case of a person having a family member with breast cancer, the recommendation is to start at least 10 years before that. Yeah? Because you might find that those tumors earlier on. We also know that there are genes associated with breast cancer. The BRCA gene is one of those that is well known. And in our population, we now start seeing young women and black women with what is called triple negative breast cancer. And I don't know if the gentleman can show the slides that I've put up here, which show persons in St. Lucia who we have had diagnosed with cancer in advanced stages, unfortunately. Not even stage 3, as Mr. Pereira said earlier on, but stage 4, where that cancer has spread from the breast to vital organs, like the liver, the lungs, the brain, the bones, where surgical interventions are no longer warranted or effective. What we do there would be, in the best circumstances, palliative care and hospice care. And when we speak of hospice, we are speaking about somebody where the intention is to improve the quality of life, prevent pain and suffering of that person, because they probably have less than 6 months to live. So we find that 75% of our patients diagnosed with cancers in St. Lucia are diagnosed in advanced stages, stages 3 and 4. In countries where screening and early diagnosis are part of our healthcare policy and programs, that is not the case. So those pictures you're seeing there, our listeners and viewers online, you will not see them in first world countries, because people do their mammograms early, people do their pap smears early, liquid-based cytology, which is the new thing for cervical cancer, which has been enrolled recently by the UHC in our health centers, where those diagnostic tests for HPV testing, you know, can be done free of charge to the population. So we ask persons to let us avoid the pain and suffering and the expense, because when we diagnose cancers in advanced stages, it becomes more tedious to treat and manage. I mean, recently I was happy to have a discussion with a colleague, and you know, we had to differentiate between treating disease and managing illness. And this is where the psychological components come into play. Disease would be the manifestation, the physical manifestations of that problem you have, whether it is diabetes and hypertension or cancer. What happens to your body on the molecular level? The illness is the experience that that person goes through having had that cancer. That psychological, emotional, spiritual catastrophe, the impact on the family members. A lot of times our cancer patients are the breadwinners of their families. And when they have cancer, they can no longer work. In the first world, cancer is the #1 cause of bankruptcy for persons with illnesses. #1 cause of bankruptcy, because it's so expensive to treat cancer. So we want to advocate, and this part of this discussion here is to raise the awareness, sensitize and educate persons that it is important to invest in your health. Be proactive for your health. Not just your health, but that of your family, your children. Because cancer in St. Lucia is the 2nd cause of years potential life lost. Years potential life lost is a calculation that is made of, if life expectancy for men in St. Lucia, I think, is about 72 years, if you die as a man at age 60, you have lost 12 years of potential life. So cancer is one of the greatest causes of potential life. It is only superseded by what? Violence, deaths. Our young men who die from violence in the streets because they die young. But cancer, among all these other illnesses, diabetes and hypertension, cardiovascular disease, is the 2nd cause of life lost. Potential life lost. So I'm happy we're having that discussion, because it brings to light a number of issues where cancer is concerned. I'd then like to ask our panel, what challenges we face in terms of accessing care, for instance, in terms of paying for diagnostic interventions. I mean, in the world we have things like PET scans that are not available in St. Lucia, but our basic diagnostic tools like CT scans and MRIs cost in the thousands. In the thousands to get one test. And you have yet to be treated. Whether it is surgery, which costs, chemotherapy, which costs more, radiotherapy, which is unavailable locally but overseas. So imagine the cost of traveling, boarding, accommodation, and getting that radiotherapy. What are some of the challenges that you have faced in terms of accessing care for cancer? Anyone can start.
Everything you mentioned before is an actual challenge. I believe now the typing can be done here, but when I was diagnosed 3 years ago, it was just after COVID. Everything had to be sent away. So obviously there was a delay because everything was backed up in the US and so on. So there was a delay to even find out what type of breast cancer I had. And without that, I could not start treatment, because you have to know which breast cancer that you're treating. So there was that. I believe that is changing now, or has changed now. Like Dr. Gabriel said, a PET scan would have shown where the cancer was. That was not available, and he's right. We had to do the CT, a full body image x-ray thing. So before you even start the chemo, you're paying out for these things. I'm glad UHC representative is here, because the other, apart from the fear of having cancer, you now have the fear of how do I pay for this? How am I going to do it? I had taken early retirement months before I was diagnosed. So I wasn't working. Thankfully, I had health insurance, and they have been very good to me. But even though they pay a portion of it, I still had to find the rest. So it's very difficult. There are a lot of things that are not readily available. Once I had completed all my treatment, which I did here, I went. Martinique was not doing the PET scan yet. It was only Guadeloupe, but I was traveling, so I decided to just do it in the US. So I did my PET scan in the US, which thankfully was clear. But I did another PET scan in September of last year, and I went to Guadeloupe. Martinique had just started, but they were more expensive, and they had their riots and so on going on, so they did not recommend that I go there. And 6 hours on express going to Guadeloupe is no fun. But it was more important for me to make sure that everything was okay. And thankfully, I got the response that I'm now in remission. But basic things, the PET scan, the testing, they're not available here. So it adds to the mental trauma that you're going through. And not just myself, my daughter, my family, because you're worried about how do we make sure all of this is paid for and we're getting the best treatments and so on. So it's, yeah, getting the treatments done, getting the testing done. Now we can go to Martinique, but that's still a whole process because you're going by the boat and you can't go on this day and you have to spend a whole 4 or 5 days before you can come back to do one test. Yeah. It continues to be traumatic because long after you have completed your test, there isn't a day that I wake up and I don't think about it. Is today the day it comes back? I tell people it's not on my mind. I don't go around all day thinking about it. But the reality is, I just don't know. And I would like for us to be at a point where we can get the PET scans at reasonable price and easily, that people no longer are saying, you know, I feel something, but if I don't know, I don't know. I'm not going to go and look at that. And go there, get your checks done, find out, because it can save your life.
Thank you. Any challenge for members of the panel?
I must agree with Ms. Rosa. For me, as a caregiver, my challenge is the finance. After being diagnosed, getting the monies for treatment, whether it is here or abroad, it is a big challenge. And even after you sold your whole property, it's ongoing. So you still need to know what do you do next after you sold your cattle, your even land. You still need to find out where would we get the finances to continue the treatment. So this is a major challenge for persons living with cancer. And another challenge that we experience is accessing like Ms. Rosak said, accessing the CT scans, the PET scans, the cost of it, and in some cases too, the unavailability of even some medications
Yeah, that's
available
true.
locally.
Mhm.
So these are challenges that
That's very true. I had to get my medication after I finished chemo. It had to be ordered. So I had to wait until it came in. And yeah, it took a long time. It took a long time to get it here. And then as we went month after month, there was a point where they ordered for me. I picked it up, and then 2 days later, the pharmacy called and said, "We have a big favor to ask you. We have someone in Viewport who needs it, and theirs hasn't come. So can we take 4 weeks of yours and give to them? And when theirs comes in, we'll give it back to you." You don't say no. We in the same boat. We battling, you know? So that's the reality of what goes on here.
Yeah.
Absolutely. Yeah, Dr. Kabi,
From my angle, I think what likely patients might face is, you in a first care, you go into fourth care once you get the information. And if you don't have basically somebody taking you along that way, you are by inertia. You don't know where to go. And some of the issues have been, is a multiple things they have to do in a short period of time. They get lost. Ms. Blozak is strong. Some of them just don't even continue going. They just
It's true.
go in denial, or they just don't follow. So it's like if you are alone in this world, once you've been given that, you've gotten that information. So that's a part, again, comes down to the team aspect of it. It's what I have done personally to aid maybe to those things. What I've said is, you have phases of cancer, for example, cancer survivors. I give them the numbers. Those who are willing to assist, to guide them. Look, my experience is through this, and you can do this, that, similar conditions. And they tend to be the best advocates actually for those patients, and they tend to assist them. Eventually, those survivors now become counselors. It's amazing how, each other as team player, they tend to become best advocates possible. Again, economy, that is a major issue. Again, not having all gamut of the services, that's a major problem for patients. So there's a piecemeal approach. Yeah. You come to me, you go to Dr. Gabriel, and or you have to get your radiation somewhere else and so forth. Having that centralized where they could get one stop is not available. So that by itself is major. In addition to the perceptions, some of them actually think is not is a death sentence. So they tend to back off. It's a lot of multiplicity issues, but I think that's how the angle I would be looking at it from my end.
thank you, Dr. Kabi. I mean, the ideal would be for us to streamline the entire process from diagnosis to, I'd say, not even treatment, but rehabilitation. What we have is a fragmented system. Sorry, and excuse me. What used to happen prior to the last maybe 15 years? Some people, out of desperation, would leave St. Lucia and travel over to Martinique. And when they got there, they would be told, "Why did you come? What you need is available in St. Lucia, whether it is surgery or chemotherapy and so on." So, and this requires teamwork, okay? The saying is, teamwork makes the dream work. So we would like to give our patients the best opportunity to have a favorable outcome. this represented here today, where we have a patient who has gone through this process and can talk about her experience in a positive way, is not the norm. The norm is the contrary, the inverse of this. The sad stories of loss, family loss, loved ones who we lose along the way. Unfortunately, I'm afraid from what we have said here today, it seems that the determining factor of patient outcome is your financial standing or your financial capability. And I hope that eventually, through universal health coverage, which is what it is defined as, we are able to ensure that our patients get screening and early diagnosis. Therefore, the cost of management becomes so much less. And the outcomes are so much more positive. I don't know whether Mr. Prevost would like to speak to us about some of the available resources through universal healthcare, where persons, I mean, we mentioned some of them earlier on in terms of cervical cancer screening, which is available free of charge throughout the communities. And I know recently the UHC launched laboratory tests for 80-year-olds and over, and for pregnant women. There were a number of issues, interventions where persons can have access to diagnostic interventions and so on.
Thank you, Dr. Gabriel. In June 2023, UHC Universal Health Coverage, under the guidance of Ministry of Health, Wellness and Elderly Affairs, we've launched a program called Maternal and Child Services, where all pregnant women on island can access the laboratory tests at the health centers, and they can, at the health center as well, they can obtain a voucher where they can use it at any of the ultrasound service providers on island. Whoever it is, once they are engaged with the ministry under universal health coverage, they can access the ultrasound. They have access to 3 ultrasounds during the trimester, and all the routine lab tests. They can also get done at no cost to them. And in August, hence when we started, I made clear that we mentioned of the prevention, the education of the population. And you realize that at the point where Dr. Gabriel gave me the mic is when he talks about the money, the finance, the hard part of it. Yes, at this time right now, that's why our director is preoccupied with right now. We are conducting a stakeholder engagement, stakeholder consultations on UHC financing policy, which will guide us, which will guide rather the government of St. Lucia how to finance the whole aspect of universal health coverage. We also carry a basket of services, which we call EPHS, Essential Package of Health Services, where it contains various health services which are considered to be a burden in St. Lucia. Today is a cancer. I will stick on the cancer part for today. We've launched the cervical cancer screening in August last year, and I can tell you I'm happy that I said prevention, that women are showing up. From August we've started to November, the number of women who've accessed that service are 1,577 who came to know their health status. We have not updated our data for December and January as yet. That's just for the first quarter when we start in 2024. The women are showing up. They are learning, and this is a good education that is happening, a good drive that's happening on island right now. And how does that help? It helps the women to know their health status. Not knowing when you are stage 3, when you reach a point of no return, that then you know what is happening to your health. So now with this process where we can go at the health center, at any of the health centers on island, all 54 wellness centers, the women can go to know that the day of the pap smear days, they can call and get that service done right at the health center. The lab comes to collect that. There's no extra effort we ask from them. The labs we engage to process these samples. They come right at the health centers to collect the samples and publish the result to all wellness centers at the same time. Now, what other service we have in terms of under cancer services? We have we have breast cancer, which we plan to launch this year, where we'll provide pap smear, pap smear for all women who will want to do the mammogram. The mammogram services will be launching, or looking at launching that this year, on this financial year, where all women will have access to come and do the mammogram at no cost to them. This will help as well to know what stage you are, if you're healthy, and what you might reach one, and the doctors might say, okay, that is reversible, we can treat that one. So all of that is the government looking at the burden diseases to reduce that health aspect, that health issues that we have hanging on our health system. What about for the men? No, not for the women only, we are for the men too. So now, on December 2nd, I believe we've relaunched the men's health clinic, where all men on island are eligible to, once you are the age of 40 and above, and to 70, we bracket to 70, but if you come older than that, we will not say no. The men can go to any of the wellness centers on Clinic Men's Day, where they will get assessed by a physician, and then to check their prostate. We know prostate cancer is a big thing in our men in St. Lucia, a silent killer. And we as men in St. Lucia, we are also silent with our health. So the time we decide to see the doctor, that's when we are about to die. So we are happy as well to report that one. The men, I was impressed. I was impressed because the numbers are growing. The men are showing up. There's a week when it comes to health in the men in St. Lucia. Something is changing. Whether it is education, whether it is fear, it's working. They come. By December to January, we've seen on island, we've seen more than 100 men who came to check their prostate. So we provide PSA, which is a prostate specific antigen test. We provide for the men to check the level of the prostate level, the PSA level. We also, if anything happens, then they can be referred to a urologist. Where further guidance will be provided, and further diagnosis will be provided, and if needs be, treatment will be provided as well. So these are all the ministry is doing by using universal health coverage, by enlarging and implementing universal coverage for the population of St. Lucia. All my recommendation, or if I should say, my only recommendation would be make use of it while it lasts. You understand? So make use of it while it lasts. Because if now you go in, now you have a chance, instead of a chance now of knowing what is going on. So the finances aspect we're doing right now, working on right now, Dr. Gabriel, to help, you see, the basic, the foundation of the issues is, how do I pay for it? So we have, the ministry has been conducting stakeholder engagement on UAC financing, as I previously stated. This document, this policy, once approved, once out, will guide the government. How we're spending it, what are we going to fund, how we're going to finance this, and what are we going to finance, and how we're going, at which point we're going to say yes or no. But we need that consultation. Hence, I'm using you now because you are not part of that invitation for the consultation we're having right now at the Financial Center, to inform you that your voice matters. So, based on the health condition of St. Lucia, you will say, okay, how important UAC is, how valuable that is, and how bad you want it, based on how it is going now. Because for everything to do it, you need money to do it, and cancer is costly.
Thank you, Mr. Prevost. Yeah. I mean, unfortunately, you know, there are so many questions I have for Mr. Prevost in terms of the uptick of the screening so far. However, I promised to be an advocate for giving each of you an opportunity to voice your concerns, your questions, ask your questions, make a contribution if you have one to make on any of the topics we've discussed so far. You will not believe it, we have been on for quite a while already, and the time is fast approaching. So at this point, at this time, I'd like to invite our audience present if you do have a question or a comment, suggestion, or something you'd like to clarify from the panel here, please approach the mic available there, and we would be happy to answer your questions. I assume that online we have the viewers online are able to send the questions in that we can then look at and try to answer. So,
yes, hello, good morning. Please let me take the opportunity to thank you all very much for coming, particularly those who are cancer survivors, for sharing your story with us here this morning. I have two questions, and that first question is in terms of the age. Perhaps you mentioned that before I came in, but the statistics as to the age that cancer is really affecting the women in our society. Because as I'm getting older, I'm 50 plus now, I'm wondering, I know it's shocking to me as well. I'm wondering whether or not my chances are now decreasing or increasing. So this is the first question. The second is, we hear all these stories, these horror stories all the time about public health care. So now that we're going to have universal health care in St. Lucia, can we really support such an initiative where we know that we've got this brain drain with our nurses, with many of our doctors? Do we have the resources? Can we sustain this financially? So two questions, the age and whether or not we can sustain universal health care. Thank you.
okay, thank you. Thank you for two wonderful questions. Certainly, age has always been considered a major, what we classify as an uncontrollable risk factor in the chronic illnesses. So sex, age, ethnicity, those kinds of things are considered uncontrollable. And certainly the group of persons who are at higher risk for cancers everywhere in the world would be 45 and above. So unfortunately, you said you're 50. But we think it's important that if you already know some of your risk factors, you can preempt the impact of age by starting your screening and early diagnosis prior to, if you have risk factors, for instance, if you have risk factors for breast cancer, colon cancer, cancer of the cervix, you are able to access some of these services offered by the universal health coverage. That will allow us to know early on what we call pre-malignant lesions and injuries that are not yet cancers, but we are able to intervene and cut them off, so to speak, if necessary, so that you never develop a full-fledged cancer. So it's important for us to know our risks and also for us to be proactive with our health by trying to do those screening and early diagnostic interventions so that we don't end up in the kind of situation we are. Now, there's lots of information online. I mean, I used to tell people that, for instance, for breast cancer, there's something called the Gale model. That is a model where it's a numerical, they tabulate your risks, age, sex, age at which you had your first period, whether you use contraceptive pills or not, and if you have a family history of breast cancer, they calculate a number that says your risk is low, medium, high, and therefore they will make recommendations based on what risk category you end up in. So there's a lot of information available that you can use, but I would say the best thing to do is to see your healthcare professional, whether it is at the health wellness centers or privately, or in our hospitals. They will be able to advise you the best processes that could help us, help you better. So that's the first part of it. Your second part of it was in terms of the...
How do we finance?
The financing. So, a lot of us, we buy our vehicle and we buy insurance for our vehicle as a mandatory component of having a vehicle. But I think last time we checked, the health insurance coverage for St. Lucia was about 25%. I think. I'm not sure. Sorry? 12%. Oh, I was above. I doubled it. 12%. 12. Okay? So can you imagine that if somebody is given a diagnosis today, lots of people will not be able to afford the treatment. And maybe let's not talk about treatment. Just the staging workup, which is the diagnostic interventions. If you have to do a CT scan, you have to come up with $2,000+. If you have to do an MRI, it's $3,000+. If you have to do something that's not available on island, you have to go overseas. So imagine the costs incurred are incremental. So 12% of us. Now I'm sure there are a number of factors in, where that's concerned. I mean, we have unemployment, we have a lot of issues going on. But it is something that we must change. And obviously the NIC covers some amount of healthcare management. I think the NIC does pay for some amount of admission costs and some minor surgical costs. I'm not sure what the actual numbers are.
In hospital.
And hospital care.
In hospital.
In hospital care, yes. But I don't think they pay for diagnostic tests. I'm sure the gentleman can give us some.
For the NIC.
Sorry?
I'm not here to speak for the NIC, but I think there's a misconception as to the NIC paying, and people didn't give a waiver because they contribute to the NIC. It's not the same thing. You're giving a waiver at the hospital because you contribute. The NIC does not pay the hospital directly for anything. So that's an area that
Yes, sir. Could you go to the mic, please? Because I'm not sure they're hearing you otherwise on our online audience.
The online
please.
audience.
For the online
Yes.
audience.
I will probably have a
Oh, absolutely.
Thank you again for part of your session this afternoon. From the contributions that I've heard on the panel, money is a major part of healthcare. Most significant part of healthcare. So even if you live well and you go out and say, you run a risk of needing healthcare sometime in your life. And being able to access healthcare requires that you have the funds to do that. If Dr. Gabriel McCarthy is supposed to put up some equipment to be able to serve the public, they need to have the assurance that they could charge a fair amount and service that equipment when used for service. Otherwise, it's a waste of money. When the pharmacy have to bring the drugs for the care of patients, they have to make sure that the persons who need it can buy it. Otherwise, it will spoil and they will suffer a loss. This is why the lady Ms. Flosak had to order special order. These things are about money and usage. Okay. And healthcare is expensive. If you try to handle it on your own, you will fail. Right? I spent a lot of years of my life in insurance. And I am now with assisting the UHC with regards to the insurance aspect of their program. People must understand that if you go it alone, it will be a heavier burden for you. If we go together, it will be a lighter burden. Whether you choose major health insurance cost, because insurance companies now have levels at which they could insure you. Basic, major, gold plus, and all those kinds of things. Choose to start, participate in the system. When you participate, when you have the insurance, you can choose that I am going to do my annual medical, I'm going to do my test to make sure. I could choose whether I go through the universal health system or whether I go to a private doctor. When you don't have a choice. You don't have a choice. Okay? And UHC is going to be doing a lot. You'll hear a lot of announcements in the next couple of days. Mr. Prevelas and other people in that unit will be saying a lot about what they're doing, but understand that your involvement is where it starts. Your involvement, you taking the initiative is where it starts.
Thank you.
I would like to answer one of the questions actually.
Dr. Kabi has a contribution.
No, I agree, absolutely agree with what you have said. I suspect the incentive will be when you detect it early, the cost of treatment of cancer very small, minuscule. And the outcome is 90-95% success rate. It's like that's supposed to be actually the incentive to early detection, minimize cost. If you go together, if everybody goes on it, it's going to be much less cost, and that active person to the society survives and lives and contributes to society. And the other question actually was, No, the age factor actually, it depends. Cancer is not one. You have multiplicity of cancer types. Maybe you actually can't tackle the most frequent ones and so forth in early detection. But you have a pancreatic cancer, you have brain tumors, you have colorectal is probably one of the, the frequent ones we can tackle. And those cancers, again, the difficulty of age detection and so forth, lung cancer, for example, it used to be at, very large in certain societies because the smoking rate is high. So it's early detection in those groups, again, goes down to particularity of seeing the doctor, seeing, looking at all the risk factors. That doesn't happen on the, on the go or talking on the roads. It has to be really nice assessment of that patient and being able to look at him once a year. If you have the risk factor, looking at those things will help identifying those multiplicity of cancers. So when it comes to the age, I would say after 40, yes, the risk factor increases depending whether if it is prostate, 45 and up colon, and up for breast. And with age, it's more cumulative effect. I think genetic contributes as a baseline predisposition, but environment also has not been talked about. There is a lot environmental intervention issues whether if it is diet, whether if it is toxic pesticides and so forth, are part of our this increase in epidemic and cancer. I think that probably answers it. Yeah.
Absolutely, thank you.
No.
Gentlemen. We have another question.
Good afternoon to all. I want to thank the planning committee and for coming out and educating us on this topic, cancer awareness, especially you nurse for championing the cause. Thank you so very much. Yes, so my question is for Ms. Dawn, Mistress Dawn.
Mm-hmm.
You took that bold step to go to the doctor. Is it something that you felt, you saw? Was it your annual checkup? What led you to the doctor's visit?
I'll be very honest. While I am advocating for your yearly mammograms and so on, I had a bad experience where I was in a lot of pain for a long time, so I wasn't doing them. I'll be honest, I wasn't doing them. And I felt the lump. And the next day was a holiday, but there was a medical facility opened and I went immediately. And we just took it like that. So within days, I was having my biopsy. Yeah.
Okay, well, I thank God that fear did not paralyze you, that you took the next step, because fear normally paralyzes us.
Absolutely.
And we cannot take the next step because we're just afraid of what the outcome might be, because sometimes it looks like the outcome is more, leading to the negative death than we surviving this outcome. So therefore, we are afraid to take the next step. So you felt that you had the lump, and maybe it's false advertisement on by myself, but I did promise the young men that that they would learn how to detect if there is any lump in the breast, because most times, sometimes, I'll not say most times, it is our partner who discovers that there is a lump in the breast or there is something going on, because we do not take the time ourselves as women to go ahead and palpate and do the necessaries. So sometimes it's discovered accidentally.
And it was accidentally. I
Thank
just
you.
happened to touch my breast and the side of my finger. I thought, that's strange. And then I realized, yeah, there was a lump there. So
with health promotion, we want to we want to promote it, so it wouldn't be something accidental, but it will be something that we deliberately go and we examine ourselves. So therefore, I would like to promote that our young guys and our young ladies in the midst need to know how to go about examining their breasts, their own breast, their partner's breast, in order to know what to look for. So we need to tailor for the young people in our audience as well. So maybe that is something that the nurses in here can do afterwards. My next question is the Ministry of Health. Is it the UHC, the service for the mammogram, is it every health center, or you'll just target some health centers on island? Because not all health centers offer every health service.
Whatever service we offer at the Ministry of Health, it is available at all wellness centers. However, if it's not available at your wellness center, you know the ministry is divided per region.
Yes.
Let's say, for instance, we have region 1, which is Babono, Lage, Fonwaso. So if the service is not available at Fonwaso nor Lage, it will be at Babono. So which means your community, your district will always have that service in it. But most of the services launched on the UC thus far are available at all 34 wellness centers.
Okay. One more thing. For our health promoters right here, I would like to suggest that what we can do as health providers, we can target the schools as early as possible. For example, we can target the grade 6 students. Let them know that the vaccine is there. Let them know that, you know, they can get the pap smear done, although at that age they will not be getting it. But they can go home and say, Mommy, you know what the doctor said, the nurse said, so we can tackle this very early, you know, very early, so that they will grow up having that knowledge and not just wondering, you know, not having the knowledge to combat it early, because as we promote, early detection is the best. So being aware also of what is available and what to look for is also the best approach. So we can target the schools, just like we have the vaccines given at the age of 12 and the nurses go in. We as nurses, we can say, okay, this is Cancer Awareness Month. We're going into every school, every primary school, and we're going to target, or every secondary school, and target the Form 1s or the grade 6 students, and let them be aware of how they can spread the news around themselves to their parents, to their aunties, and also they have the knowledge for themselves as a person growing up in society, so we can have less cancer cases going around. My recommendations. Thank you very much.
Thank you so much. I'm so happy that this question and contribution came from one of our budding nurses. Yeah. I wanted to say that I certainly welcome your contribution and your perspective there. I want to add that this must take a multifaceted approach in terms of in the formation of our healthcare professionals. It is important to imbue the component of public health. So, you know, I'm not sure there is a specialization of public health nursing on island.
There is.
There is?
There is.
Okay. So if we start creating our healthcare professionals with the whole overall view of public health concerns and addressing public health concerns, we might have a better chance of reaching the goals that we want. Because we've been doing this for many years now, Dr. Kabi, 30 years, I think you said. Almost 30 years, yeah. And myself. And maybe what we've been doing has not been working well, because we still see the cases in advanced stages, and we still have people who lack the ability to access care. They're lost in the system. They don't know where to go and what to do, or have the finances available. So I think this has to be a whole of society approach. It can't just be that we allow the government and the ministries to do what they have to do, but private citizens, corporate society, our academic institutions must come on board this ride, so that we do everything necessary to ensure that our population is, one, sensitized and educated as to what they must do to ensure that they get the best outcome possible when they are diagnosed with one of those chronic illnesses. Yes, thank you.
Okay, so The first instance, this is not what I was going to say first, but since she brought it up, I feel like I need to defend myself. So, first of all, yes, we do go to the schools and we do educate the primary school students and secondary students. For each region there is, except for Region 4, which is Miku, we do have a family life educator and a health educator. And as you know, at the same time, there are many, many schools and just one of us. So it's, so it can be quite a challenge for us to be able to reach every school and plus workplaces and churches and all the different areas that we have to go to. But we try our best, and even when we do the health fairs and we invite the schools, they do come and we show them how to do the breast self-exam. So, and like you said, just your department can just reach out to us, the Health Education and Communication Unit at Ministry of Health, and we'll be happy. And actually, I would be the one coming to do and show them how to do the breast self-exam on any other information that they need to do. Need to know on health. My second thing is the first instance when we spoke about fear. Fear is something that really is what's the word I'm looking for? A hold on us. And what I want persons to really get out of it is that fear of something doesn't change the outcome. It would not prevent you from death. It would not prevent the cancer from spreading. So it would be very important for us to get screened as early as possible, that we do our yearly screenings. And especially, and Dr. Gabriel would know, once persons are at very high risk or at high risk for the cancers, that we start doing these things early. So we, the young persons in the room, that we don't have this perception that I'm young, that this would not happen to me. We have to understand that we have to start now, that we get to know our bodies and know what is happening. So as soon as we see or we feel, like you said, you touched, you know this is not something that's supposed to be there. This is something that needs to be checked. And we should go and get our screenings early. So for example, think of it like a car. We have a car. We don't just run the car. We have to go and get it checked. So why don't we go and get our bodies checked? Because the same way the car ages, so do we. So we need to go and get our checks. And the wellness centers offer them, thankfully, for free, okay? Or at a very minimal cost. And once you detect that thing early, like Dr. Kabi said, the cost of treatment goes down. And when we say that, as soon as that person receives that diagnosis, we see the person going down and they die, I think it comes twofold. One is psychological, and two, most persons get that diagnosis at a late stage. So the ability for the treatment to work is reduced. And this is the reason why the person ends up going to, unfortunately, passing away. But most of the time, it's because of that late stage. And this is what we need to try to avoid. And lastly, I would like to say, we did mention about the PSA, and I want the men to know that the PSA, the test is a blood test. You mentioned it, let them know. It's a blood test because every day, from what I'm seeing, is everybody's afraid of the digital. So the PSA is a blood test, but the digital is also very important. But just know when you go to the wellness center, it will be a blood test. Okay, thank you.
Thank you so much. I'm so happy we have the discussion. No, absolutely. I think we have just enough time for maybe one, probably two other questions. Yeah? If we can be as brief as possible, or comments and contributions. Thank you.
Thank you guys for coming. It's an honor to actually be a part of the panel because just a conversation. And I'm currently doing my PhD and my focus is breast cancer. So I'm also a medical doctor. I don't really practice. My focus is research. But I noticed that in the time that I was practicing, as much as the universal health care coverage is considering or has put in the plan for the screening, you know, I think if every type of disease, mental health is a very strong issue. And as much as you may get your testing done and you're able to get a biopsy done or screening done, you want to know mentally where you are. And I really want to ask the universal health care coverage personnel, are you guys considering healthcare for mental health? Are you actually considering that with this group of patients, this cohort of patients? I think it's a very important question to ask because most people don't have the family support that they would need to go through a situation like that. So that's my question. Thank you.
Thank you, Doc.
Thank you for the question, though. As I previously mentioned when I started, I said we have a basket of services which we call essential package of health services. Yes, mental health is part of that package as well that we plan to offer. And palliative care, I believe Dr. Gabriel was going to rush to go in. I noticed his body language. And the palliative care training we provided for all nurses, caregivers, physicians. You were part of it as well in that training. And this gives you the knowledge led by Dr. Gabriel. It gives you the knowledge of who you're dealing with, knowing your patient, and help them mentally. All of that is part of that service as well. But engaging directly the psychological aspect of it, it is also part of the service plan to offer. Yeah.
Thank you, Doc. Anybody else wants to comment? You know, I mean, we've had all this discussion. Is there one other question? Absolutely. Just before, okay, thanks. I was just going to say that, you know, I mean, a lot of times, you know, in the Ministry of Health, we collect this data, and because we're dealing with illnesses, we look at the social determinants of health. You know, just to construct, sort of classify what persons are more at risk of getting illness and so on. But I think it's time for us to look at what puts somebody at risk of dying. So the social determinants of death should be a category that nobody talks of, but it should exist. You know, because as we've discussed here, a lot of times lack of financing, the economic component, the economic factor is what leads to death in a lot of cases. Obviously, there are things like education levels and this, that, and the other, but you know, it's time for us to delve deeper into the whole of the issue. I think we're still scratching the surface. So it leaves room for research as well, Dr. Joseph, for research in the areas of you know, the determinants of death in our country. You know, I mean, cancer is killing lots of people. So we might look into what other things, apart from the illness, might make a person die, and you know, and maybe we can intervene in one of those factors and change the outcome eventually. Thank you.
Good afternoon to all. Thank you for coming today and present us, giving us awareness on cancer and what it is. I'm glad that I walked in accidentally, but I'm glad that I'm here. I have learned a lot joining you guys today, so thank you again for being here. I have two questions. My first question is, I heard that, thanks for the invitation that you gave us to do the pap smear and also the prostate test. I would like to know if there is a due date on that invitation. If yes, when is the due date? So I can urge my husband to do his prostate test.
That's for screening, yeah.
Yes.
No deadline on the invitation.
As yet.
No invitation. No, I mean no deadline. No deadline. Okay. It's open. It's available. The service launched in December, and they can go at any wellness centers.
Okay, great. Thank you.
So I think it's ongoing, and I think he said on Wednesdays at the Wellness Center. So it's ongoing, and
It's ongoing, yeah.
Okay, great. We live next to a health center, so
I
I'll definitely help.
When we hear Wellness Center is every third Thursday.
Okay, great. Okay, thank you for that information. My second concern is that I heard a lot of people, what was shared today and what I heard outside of these walls, a lot of people tend to travel whenever they're sick because they believe that the treatments are not available here. So I'm thinking that, is there any assistance provided to prevent people from wasting time and wasting money in having is there any breach between the health system in St. Lucia and the health system in Martinique, Guadeloupe, elsewhere?
yeah.
Is something that is part of a plan, or if it exists, if it's existing?
Yes, thank you. Wonderful question. It's one of the obstacles that we face. So there are two things involved. Some people do not access the public health care system. So some people, and especially with Martinique, a lot of times our people have relatives in Martinique. So there are historical and traditional bonds. So they would just go there without engaging the healthcare system down here. So that we can't intervene there because you are free to choose where you want to go. Some people go to the United States, and some people go to Cuba, you know, wherever you have the link to go to. However, recently, since the formation of organizations like Faces of Cancer, the Central Cancer Society, if you stay within this public healthcare system, you are able to access information. And certainly in my private office, for instance, the patients will be given a list of possible institutions, facilities overseas where whatever diagnostic intervention has to be done, can be done. Sometimes we give them the costing and so on. So we're able to guide them into that transition from local care into overseas care. But that is not a standard protocol type thing. This happens depending on which patients I'm dealing with, or which patients, you know, in terms of what they have, the linkages they have otherwise. I think it's important to have that discussion actually. And years ago, the ministry attempted to harmonize the services offered in Martinique and St. Lucia. And that didn't last very long. You know, we had an MOU signed with the French regional office and agency and CHU Fort-de-France. And but some persons still went ahead and sought treatment, a lot of times under the guise that the government will pay for it in Martinique, and eventually it was never paid for. And certainly the French, you know, obviously became less willing to open their services to us. We also did a collaboration with Guyana, where radiotherapy was being given as well. And sometimes doctors know colleagues who work in those countries, and be able to speak to them directly and arrange for patients to go through the system directly to a particular physician, a specialist, if that's the case. So it's not well streamlined. It's still something that happens haphazardly, unfortunately. But I think it's something that needs to be addressed.
Thank you very much.
Yes? There's a gentleman, and then we come back to you. Yes, Dave.
Good afternoon.
Good afternoon.
I would like to know, how exactly does breast cancer affect men, and how common it is in St. Lucia?
Yeah, very good question. Yeah. So I'm sure Dr. Kabe has some information on that, but I have seen in the last 20 years I have had four men with breast cancer in St. Lucia.
I would say dozens I've seen in my practice in St. Lucia. It's not as common as in women, but it happens in the 50s, 60s, usually late age, and few have been. I've had a patient, almost 89, 90-year-old, which with surgery alone, I think he lived, he's still alive. It usually comes in late. They have a lump, and when you diagnose it, is advanced, because we don't have any screening tools or tests. You don't have breast tissue by itself, so to do a mammogram, which is a recommended test, is difficult.
Yeah.
And also the awareness factor. Very good question. Awareness factor is not there. So usually when they feel a lump or is a little bit matted and advanced, that's when they come in. It is aggressive, and the treatment usually is the same as in women. But since you don't have any breast tissue to keep it in the breast, the spread is faster. It tends to metastasize faster than in women.
Yeah. So the ratio is for every 100 women with breast cancer, there'll be one man with breast cancer. And certainly, I think we've seen more than our share of men with breast cancer. And as Dr. Kabir suggests, men do not think that they can get breast cancer, which is why your question is so important. So when we tell men to examine themselves, obviously men know, I'm sure men do the scrotal examination for testicular cancers and so on. You should also check your breasts, especially men who have family histories of breast cancer. If you had a mother or a sibling with breast cancer, a first-degree relative, then you probably want to be more observant about developing breast cancer yourself. That's why I spoke about risk factors. If you know your risk factors, then it's easier to focus into a particular area of developing a certain kind of cancer.
But in a younger age, you have what's called a gynecomastia, which is bilateral. It can get confused, and the youngsters can get a little bit concerned. There is a second appearance of gynecomastia in the 50s, 60s, where the hormone levels go down. That also can be confused. But then differentiating that bud of a breast tissue vis-a-vis the lump. You have a matted, hard, usually it's a hard, stone-hard lump, where that would be a concern, is on one side of the areola, or takes the whole areola. Yeah.
Okay, thank you very much.
Welcome. Well, thank you for the question. They say all good things must come to an end, and it has been signaled to me that I might be fired if I don't wrap up the session immediately. So I would like to take this opportunity to say thank you for our in-house audience, and certainly those online who have spent the time listening to us and making contributions online, comments and so on, and questions that hopefully we can answer eventually. Certainly, our panelists here, thank you so much for your contributions. I know people have a lot more to say, a lot more to get out there, but the time will not allow. Thank you all for coming. Thank you to Sir Arthur Lewis. And I'm sure, obviously, Nurse Grandison, most thanks to her for her.
Thank you, Dr. Gabriel. So as we wrap up today's cancer talk, I invite everyone to go to the information table and collect some information, and also our guests present to remain for some refreshments. And blessings to you, and have a wonderful day.
Thank you.
Thank you.
That wasn't good at all.
Oh my goodness, I didn't get through half of our questions. Anyway, it was good. I think a lot of things came out of there.
Yeah.
I think a lot of things came out of there.
Your donations to national cancer causes fuels research, supports care, and creates a brighter future for those affected. Pledge to get your annual screenings. Early detection saves lives, giving you the power to act before it's too late. Pledge to adopt healthy habits, stay active, eat nutritious meals, and prioritize your well-being. Healthy lifestyles can reduce your risk of cancer and pave the way for a healthier future. Make your pledge and act against cancer with lifestyle, screenings, and advocacy. Together, we can make a difference. This message is brought to you by the Ministry of Health, Wellness, and Elderly Affairs.